In this part, I'll be talking about cerebral vascular supply and then specifically focus on the anterior cerebral artery and consequences of disruption of that artery. Here in the image on your right, you can see a simplified version of the vascular supply to the brain. And I just want to say that a full discussion of the full vasculature of the brain is beyond the scope of this presentation, and so we'll be focusing on some of the major arteries within the brain, but that's not to say that this is the full discussion of the brain vasculature. So I just want to start by saying, again, we can see in the upper right part of this image a circle formed, which is known as the circle of Willis, and the circle of Willis is comprised of several arteries that we'll discuss. So the anterior supply of the brain, which includes the anterior cerebral artery and the middle cerebral artery, as well as the anterior communicating artery, give rise from the internal carotid arteries. So in this image, you can see that the internal carotid gives rise to the middle cerebral artery, as well as the anterior cerebral artery. And I'll be using abbreviations for the remainder of the talk, ACA and MCA. You can also see the anterior communicating artery as a smaller artery that connects the ACA and the MCA. If we look at the posterior circulation, we see that this gives rise from the vertebral artery, which then leads to our basilar artery, which then branches off into the PCA, or the posterior cerebral artery, left and right branch. We also see the posterior communicating artery, which really connects the posterior circulation to the anterior circulation of the brain, so that PCA to the MCA and ACA. And there we have this circle of Willis that's formed. Most individuals do have a circle of Willis present in their vasculature on the floor of the cranial cavity. Let's talk a little bit more specifically about the anterior cerebral artery. On the images on the right side of your screen, the purple area you can see is the area of the brain that is supplied by the anterior cerebral artery. So as you can see, this is most of the anterior medial surface of the brain. This includes the medial and orbital frontal cortex, the anterior corpus callosum, or the front of the corpus callosum, the medial parietal lobe, as well as the motor and sensory cortices, the olfactory bulb and tract, the anterior basal ganglia and internal capsule, and then on the lower image, that purple strip you can see, the ACA does supply about 1 inch of the lateral surface of the brain as well. As you can see, there are several branches of the anterior cerebral artery. We won't be discussing each branch in detail, but we'll be discussing the functional outcomes after a stroke anywhere within the ACA vasculature. So there are both physical and cognitive consequences of a stroke in the anterior cerebral artery. For my talk, I've divided my discussion of consequences of the stroke into left and right hemispheres. And so we'll kind of take that approach as we talk about strokes in different vasculatures of the brain. We'll talk about what it looks like on the left, what it looks like on the right, and then what it might look like bilaterally. Having a stroke in your left hemisphere of the anterior cerebral artery oftentimes results in lower extremity, leg and foot weakness, paralysis, and sensory loss. We also tend to see frontal lobe behavioral abnormalities. That might look like flat affect, abulia, which is a lack of initiation of behavior. We might see individuals with poor reasoning and impaired judgment. We might also see individuals who are somewhat disinhibited. That means they may act without thinking, so to speak, may say things that they wouldn't usually say. And this can be a direct consequence of the location of an ACA stroke because of the involvement of the frontal lobes. We also might see what's called a transcortical aphasia, and I'll be talking about aphasia a little bit more extensively in a few slides from now. But just know that a transcortical aphasia is a language disturbance, which we might see in the left hemisphere or the language dominant hemisphere for most individuals. When we have a stroke in the right anterior cerebral artery, we will oftentimes see again that contralateral weakness of the lower extremity, so leg and foot, because of the location of the leg and foot on the motor strip, as well as weakness, paralysis, and sensory loss in that contralateral limb. We oftentimes will see a left hemi-neglect. We know that neglect is much more common in right hemisphere strokes, and so we might expect to see a neglect with a right anterior cerebral artery stroke. And again, we might see some similar frontal lobe behavioral abnormalities or difficulties. Again, poor judgment and possibly poor insight into areas of difficulty also could be called poor self-awareness. When we have a bilateral ACA stroke, which oftentimes is secondary to a ruptured aneurysm on the anterior communicating artery, which we looked at a little bit earlier, we see some pretty profound consequences. Oftentimes with bilateral damage to the medial frontal lobes, we see what's called an akinetic mutism. We might also see profound lack of initiation of behavior. Oftentimes, these individuals might look severely depressed when in fact, these are neurologic consequences to the location of their stroke. We also might see poor memory. Again, those same executive impairments I talked about, reduced attention and working memory, as well as some behavioral and mood changes. Thank you.